Prostate cancer is one of the most dangerous types of cancer that men can get. According to the American Cancer Society, the only kind of cancer that affects males more often than skin cancer is prostate cancer. It is estimated that around 1 in 9 men will be diagnosed with a malignancy at some time in their life. It is anticipated that in 2022, approximately 200,000 men in the United States will be diagnosed with prostate cancer for the first time, and that the disease will claim the lives of more than 40,000 men. On the other hand, if it is caught and treated at an early stage, prostate cancer has a lower risk of becoming fatal. Because of this, it is essential for men to be aware of the symptoms of prostate cancer in its early stages. What you need to know about prostate cancer. The prostate isn't something that most men pay much consideration to till it starts giving them complications. It is located under the bladder and surrounds the urethra, which is the tube that transfers fluid to the penis. The tiny gland is important for creating seminal fluid, which is fluid that helps sperm exit a man's body. Cancers that originate from gland cells are referred to as adenocarcinomas, and the vast majority of prostate cancers fall into this category. There are 2 types of prostate cancer, those that develop fast and those that develop fairly slowly. According to the American Cancer Society, some men might have prostate cancer that is undetected for decades without the disease developing any symptoms or complications. On the other hand, the dangers associated with prostate cancer are fairly significant, especially after the disease has spread to other parts of the body. There are symptoms of prostate cancer that can be observed by self-diagnosis. This being said, men should have prostate checkups regularly by a healthcare professional. Here are 10 warning signs of prostate cancer. Before we get into it, please remember to like and subscribe. Let's get going. Number 10. Painful or burning urination. The enlargement of the gland caused by prostate cancer disrupts the regular flow of urine. Urine flow obstruction is the cause of painful micturition. It is also conceivable that painful urination results from the spread of cancer to neighboring structures. Local invasion of nearby tissues, such as the urethra, bladder, and rectum, is a defining characteristic of prostate cancer. Burning during urination may be caused by a suppurative infection or by treatment-related adverse effects for prostate cancer. The gland's hypertrophy results in urinary blockage and retention. Infection of the urethra and bladder caused by excessive urine retention may cause burning during urination. Antibiotics may provide temporary relief, but the doctor must begin prostate cancer treatment to prevent future dangers and problems. Consultation with your physician is the most effective method for avoiding the dangers of undetected prostate cancer. Family history and genetics are key risk factors for prostate cancer, but changes in lifestyle and nutrition might amplify these warning signals since obesity can worsen painful micturition. Number 9. Frequent nocturia and urination. Frequent urination and nighttime urination are hazardous warning signs when prostate cancer is suspected. Nocturia is the condition in which a person must wake up to urinate throughout the night. Sleep disturbances might worsen a patient's health condition. Due to repeated toilet trips throughout the night, nocturia may make a person feel exhausted in the morning. If you are bothered by the number of times you wake up throughout the night to void your bladder, you should see a physician immediately. A bladder diary is regarded as an essential instrument for assessing the severity of the disease. Urinary or fluid diaries need accurate tracking of the patient's 24-hour urine output. Number 8. Blood in the urine. The presence of blood in the urine is known as hematuria. It is only detectable in the most aggressive and advanced stages of prostate cancer. In prostate cancer, 2 distinct kinds of hematuria may manifest. Microscopic hematuria is characterized by the presence of red blood cells in the urine that are only visible under a microscope. Red blood cells may be detected with the naked eye in the urine of a patient with macroscopic hematuria. 3 to 5% of prostate cancer patients may exhibit blood in the urine. In this scenario, the color of the urine changes to red or pinkish. This is related to the prostate cancer's invasion of other areas of the urinary system. Kidneys, ureters, and the urinary bladder are the most prevalent sites of infection. Regular urine examinations are essential for accurate diagnosis. Urinalysis, urine cytology, a genital exam, rectal exam, urine culture, and ultrasound are often requested to find the etiology of hematuria. Number 7. Pain in your back, hips, or legs. Extreme discomfort may be caused by prostate cancer in the thighs, hips, and lower back. This is caused by the metastatic spread of prostate cancer to the bones in the aforementioned locations. New bone cells are affected by bone metastases from prostate cancer. A study was conducted on male patients with back, neck, and pelvic discomfort. Men with back pain had a 50% greater chance of being diagnosed with prostate cancer than men without back pain, showing a clear relationship between back pain and prostate cancer. In addition to this, men with advanced prostate cancer often complain of limb weakness and numbness. If you feel you have lower back, pelvic, or thigh discomfort owing to an unknown reason, you must see a doctor. Number 6. Sudden weight loss. Weight loss is connected to all malignancies, including prostate cancer. Appetite loss, nausea, and vomiting are the leading reasons for weight loss. The scientific explanation for these symptoms is still debatable. In addition to appetite loss, prostate cancer patients sometimes notice a change in the flavor of certain foods. If you are experiencing unexplained weight loss, you should visit a physician at once to determine the reason. In order to prevent extreme weight loss, doctors suggest consuming a high caloric intake. Likewise, nausea and vomiting may be managed with the correct medication. The risk of problems might be increased by ignoring these signs. Number 5. Pain in the rectum. The spread of prostate cancer to the rectal area may cause rectal pain. Due to tumor invasion of the rectum, constipation, fecal urgency, fecal incontinence, flatulence, subtotal bowel blockage, diarrhea, and other bowel abnormalities might occur. You must see your physician at once in order to treat these symptoms and find their precise cause. Digital rectal examination, ultrasonography, and PSA screening may aid the physician in determining the correct illness etiology. Number 4. Painful ejaculation. Ejaculation that is painful may be detrimental to a person's sexual relationship as well as his sense of self-worth. About 2 to 3% of men will experience excruciating pain during ejaculation if they have prostate cancer. The pain that follows ejaculation may last for more than 24 hours. Individuals have on occasion reported experiencing discomfort before ejaculation. Nevertheless, it is far more typical for patients to experience pain post-ejaculation. Number 3. Pain while sitting. Because of the patient's enlarged prostate gland, sitting for long periods of time might be quite painful. Patients who have prostate cancer often complain of discomfort and numbness in the perineal area when they are seated on a hard surface. This kind of prostate cancer, known as prostate adenocarcinoma, is the one that is the most often connected to experiencing discomfort while sitting. It's possible that you have prostate cancer if sitting causes discomfort in your pelvic or lower back. Number 2. Problems urinating. Urinary retention in the bladder may make it impossible for those who have prostate cancer to urinate because of the condition. The local invasion of the tumor, as well as an enlarged prostate gland, are the primary factors contributing to the individual having difficulty emptying his bladder. It is strongly recommended that you see a urologist as soon as possible if you find that you are experiencing difficulty while urinating. Number 1. Loss of bladder control. Another potential warning sign is a loss of control over one's bladder. Urinary incontinence is the phrase that is most often used to refer to this problem in the medical field. The symptoms of urine incontinence might vary depending on the kind of prostate cancer a patient has. The 2 primary forms of incontinence that patients report experiencing are stress incontinence and urge incontinence. Loss of control of one's bladder might be a symptom of a disease's progression. Nevertheless, radiation therapy and prostatectomy are the 2 most common medical treatments that are responsible for this condition. The prostate has a role in the regulation of the passage of urine from the bladder to the urethra. The inability of the bladder to hold urine, which leads to dribbling and nighttime bathroom trips after a prostatectomy, is performed to halt the progression of prostate cancer. Urinary incontinence might be a side effect of surgery on the prostate because it risks causing damage to the nerves that feed the bladder. Because of the many treatments available for prostate cancer, 25% of men have a loss of control over their bladders. Now that you know some of the symptoms of prostate cancer, are you at risk? Included among the risk factors for prostate cancer are older age. As you age, your chance of developing prostate cancer increases. It is prevalent after age 50. Race. Black men have a higher risk of prostate cancer than those of other races for unknown reasons. Additionally, prostate cancer is more likely to be aggressive or progressed in Black men. Family ancestry. If a parent or sibling in your immediate family has been diagnosed with prostate cancer, your risk may be enhanced. Additionally, if you have a family history of genes that increase the risk of breast cancer, BRCA1 or BRCA2, or a significant family history of breast cancer, your risk of prostate cancer may be increased. Obesity. Obese individuals may have an increased risk of prostate cancer compared to those with healthy weight, although research results have been inconsistent. In obese individuals, the cancer is more likely to be aggressive and to reoccur after early therapy. There are preventive measures you can take to reduce your risk of prostate cancer, namely, choose a diet abundant in fruits and vegetables. Eat a variety of fruits, veggies, and whole grains. Vegetables and fruits include several vitamins and elements that are beneficial to health. Select nutritious foods over supplements. No research has shown that supplements reduce the risk of prostate cancer. Exercise during the majority of weekdays. Exercise enhances your general health, aids in weight maintenance, and boosts your feelings of happiness. Exercise at least 3 days a week. If you're new to fitness, start slowly and gradually increase your daily exercise time. Maintain a healthy weight by eating nutritious food and exercising if your present weight is in control. If you need to lose weight, increase your physical activity and minimize your daily caloric intake. Ask your doctor for help in developing a healthy weight reduction strategy. Discuss your elevated risk of prostate cancer with your physician. If you have a very high chance of developing prostate cancer, you and your physician may explore medicines or other therapies to minimize that risk. Several studies show that 5-alpha reductase inhibitors, such as finasteride and dutasteride, may lessen the chance of getting prostate cancer. These medications are used to treat enlarged prostate glands and hair loss. However, some data suggests that these drugs may raise the chance of developing a more severe type of prostate cancer in those who use them. Consult your physician if you are worried about your chance of getting prostate cancer. Men with prostate cancer may show a wide range of symptoms. The majority of men do not show any symptoms. Prostate cancer is curable, particularly when detected early. Don't worry and don't leap to the worst possible conclusions. Just call your doctor if you experience the symptoms we've described. Please watch these videos for more. Please like and subscribe, and thanks for watching.